Good evening, all. My name is Tiffany Jones, and I'm the Marcus Lord Coordinator for Arlington County with the Department of Human Services. It is my great honor and privilege to introduce some of my prestigious colleagues and our wonderful partners who will educate you all on our crisis continuum of care. First, I'll highlight Ms. Wendy Rose, Manager of Crisis and Diversion Programs with the Northern Virginia Regional Projects Office. Wendy Rose, with over 25 years of experience in the behavioral health field, serves as the Manager of Crisis and Diversion Programs with the Northern Virginia Regional Projects Office. She helps oversees the management of the Marcus Alert implementation in Region 2 and the contract for HopeLink and REACH. She will be representing HopeLink today on their behalf, who operates the Regional Crisis Call Center in Northern Virginia and manages 988 crisis calls. Through client-centered, community-oriented, and collaborative approaches, HopeLink inspires hope and provides support for individuals and families experiencing behavioral health crises and challenges. Secondly, presenting is Ms. Rhiannon Price, Clinical Director with Community Regional Crisis Response, also known as CR2. Ms. Rhiannon Price, a licensed clinical social worker with deep expertise in trauma-informed care and program development, serves as the clinical director for CR2, which provides 24/7 mobile crisis response and community stabilization services in Virginia. Today, Ms. Price will share the services that CR2 has to offer when children, youth, and adults are experiencing a behavioral health crisis. Thirdly, Ms. Stephanie Ramirez, Clinical Director with REACH Northern Virginia. Stephanie Ramirez, a licensed clinical social worker with over 8 years of experience in the behavioral health field, serves as the Clinical Director for the Regional Education Assessment Crisis Services Rehabilitation, also known as REACH. The REACH program was established to serve individuals with behavioral health challenges and with an intellectual and/or developmental disability in Virginia. Today, Ms. Ramirez, will elaborate on the various services that the 24/7 program has to offer related to crisis care. And lastly, Gabriel Dewar, Client Services Entry Bureau Director for Arlington County Community Services Board. Gabriel Dewar, with over 30 years working in the behavioral health field, serves as the Client Services Entry Bureau Director in Arlington County. Through his extensive expertise of managing a range of crisis programs, Mr. Dewar will share how his bureau helps carry out the crisis continuum of care in Arlington. Today, he will elaborate on how these managed programs serves as the foundation of the Marcus Alert framework, which aids in increasing the likelihood of behavioral health responses in our community. Thank you, and now we'll have Ms. Wendy Rose.
Good evening, everyone. I will ask for grace because I got a text on my way here that I had to cover this. So I'm just going to be straight reading from the laptop, so I apologize for that. Go ahead, next slide. The next slide. Okay. Recent research shows the 988 Suicide and Crisis Lifeline is effective in de-escalating crises and providing support, with the vast majority of callers reporting that the service helped them. A May 2025 study in suicide and life-threatening behavior found that 98% of suicidal callers felt the call helped, with 88% saying it stopped them from killing themselves. Next slide. 88.1% of callers who were considering suicide said that their crisis call stopped them from killing themselves, either a little or a lot. Perceptions of effectiveness were strongly tied to the counselor's behavior, particularly how well they fostered connection and helped with problem solving. HopeLink was one of the centers that participated in this study, offering a considerable sample from our region. This is hopeful research. Next slide. 988 is a national hotline offering one-on-one support for mental health, suicide, and substance use-related problems for anyone 24/7. No matter where you are in the United States, you can call or text the number 988 or chat online at 988lifeline.org and connect with a skilled, compassionate crisis counselor. The 988 Lifeline is a direct connection to immediate support and resources for anyone in crisis. There's no reason too big or too small to reach out to 988. People can also call, text, or chat 988 if they are worried about a loved one who may need crisis support. 988 call, chat, and text services are available in English and Spanish. Call services with interpreters are available in more than 240 languages. Virginia's approach is unique. The 988 TAC supplements service delivery, broken down by planning regions and supported by networked centers like HopeLink. There's a current mismatch between demand and funding, which is why the National Backup Network is critical to ensuring timely response. In Northern Virginia, people can also access the Regional Crisis Call Center directly at 703-527-4077. And the next slide. At HopeLink Behavioral Health, or what is known as the Regional Crisis Call Center, it operates as a designated 988 network center, which means HopeLink is directly integrated into the National Crisis Response System. As part of this network, HopeLink services are guided not only by federal expectations, but also by a specific standard set at the state level, ensuring consistency, accessibility, and accountability in every contact managed. HopeLink is bound by a formal network agreement, which outlines how we deliver care across all modalities: calls, chats, and texts. This agreement is more than a contract. It's a shared commitment to service excellence across the entire 988 ecosystem. Being part of a networked model means we don't work in isolation. HopeLink adheres to a uniform set of policies and procedures that govern how we intervene in crisis situations. Most importantly, HopeLink's work is guided by a commitment to evidence-informed practices, trauma-responsive care, and person-centered engagement. Whether someone is calling for the first time or reaching out after many attempts to access support, they are met with compassion, professionalism, and a deep respect for their autonomy and dignity. Next slide. When someone is in crisis, it's important to connect them to the right kind of help. That's why knowing the difference between 988 and 911 is essential. 988 is the number to call for a mental health, suicide, or substance use crisis. It connects people directly to trained crisis counselors who provide emotional support, de-escalation, and safety planning 24 hours a day, 7 days a week. The goal of 988 is to stabilize the crisis with care, not force. Most of the time, that support can be offered without involving emergency services or law enforcement. 911, on the other hand, is designed for medical emergencies, fires, crimes, or immediate threats to safety. Dispatchers send police, EMS, or fire personnel based on the situation. While 911 responders do important work, they are not mental health specialists, and involving law enforcement in behavioral health situations can sometimes escalate rather than de-escalate the crisis. The key difference is this: 988 responds with support, 911 responds with dispatch. 988 is for emotional and behavioral crisis. 911 is for physical and public safety emergencies. Next one. Let's talk about what actually happens when someone contacts through 988 or our regional crisis line. There are 3 primary outcomes, and each one reflects a trauma-informed, clinically grounded approach to supporting people in crisis. First, over 90% of contacts are fully resolved at the call center level. This means the person is heard, de-escalated, emotionally supported, and empowered to move forward safely, all without needing to access emergency services. That's a powerful statistic. It shows that early intervention works. People in crisis often don't need hospitalization or law enforcement. They need connection, validation, and options. Second, a small percentage of contacts are warmly transferred to another service. Whether that's a community services board, a housing resource, food assistance, or another support system that can meet the person's broader needs. These aren't cold handoffs, they're warm transitions, coordinated in real time to ensure the caller doesn't fall through the cracks. And finally, thus less than 2% of all contacts result in a public safety referral, when someone's safety is so at risk that emergency intervention is necessary. But this is truly a last resort, not a first response. What makes this process work is not just the staff's compassion, but their clinical judgment, their training in suicide risk and safety assessment, and the strength of the continuum of care partnerships HopeLink has built across the region. Every outcome is guided by the same core value: helping people stay safe, stay in control, and stay connected to care on their terms. And next slide. When someone reaches out through 988 or the regional crisis line, what happens next is more than just a conversation. It's a carefully guided, trauma-informed process grounded in human connection and clinical skill. The contact begins with active and reflective listening. Most individuals in crisis don't need immediate solutions. They need to feel heard, seen, and safe enough to talk. As the conversation unfolds, counselors are always assessing for suicide risk, but not in a checkbox kind of way. HopeLink uses structured, evidence-based tools, yes, but the focus is on understanding the person's capacity for safety, not just whether they're currently at risk. Counselors may ask, can you keep yourself safe right now? And what would make that feel more possible? The goal isn't to take control. It's to empower the person in crisis to choose safety for themselves. Counselors engage in collaborative safety planning that honors autonomy and dignity, even in the hardest moments. If additional support is needed, HopeLink doesn't stop at suggesting services. They offer referrals to live, available resources, places that are open now and ready to receive the person. Whenever possible, counselors make warm transfers, meaning they stay on the line until that handoff is complete. This isn't about pushing people through a system, it's about building a bridge to care. And for those with more complex needs, like someone navigating both housing instability and behavioral health challenges, HopeLink can go even further. Through care navigation, navigators walk alongside individuals beyond the initial crisis, helping them identify and overcome barriers to long-term support. At every step, the focus remains the same: to meet people where they are, offer connection, restore safety, and link them to the care that they deserve.
Good evening, everyone. My name is Rhiannon Price, and I will be presenting tonight on CR2, which stands for Community Regional Crisis Response. Next slide. So who we are a mobile crisis service who provides services 24 hours a day, 7 days a week for non-hospitalized individuals of all ages who are seeking help and experiencing a mental health crisis. The services that we offer are mobile crisis response, community stabilization services to eligible individuals, and we serve a lifespan program. So we serve individuals of all ages, from the elderly to the very young. So our eligibility, CR2 provides 24-hour in-person responses to children, youth, and adults who are facing a mental health and or substance abuse crisis who may be at risk for hospitalization. All of our clients must reside in the following Northern Virginia regions and counties of Arlington, the City of Alexandria, Fairfax, Loudoun, and Prince William. We do have mobile crisis coordinators who speak English and Spanish fluently, as well as we are able to utilize interpreter services for our clients who need that. And our services are provided free of charge, regardless of your insurance. If you do have Medicaid, then we will bill Medicaid for our services. Otherwise, we are free of charge. So how to access services. Families and community members can call the Regional Crisis Center at the same number that's on our screen. School staff and sister agencies can call our provider line directly at the 571-778-4209. And what to expect. We have QMHPs, we have trained mental health professionals who will respond to the crisis. We will arrive within 60 minutes to your location, and we work to de-escalate the crisis. We complete assessments, make recommendations, provide 2 additional follow-up days for anyone who is in a crisis, and that's to help provide service linkages. We also have a psychiatric nurse practitioner who is available for needed consultation, medication management while we're getting you connected to an ongoing provider, and again, that is free of charge for our services. We also will work with warm handoffs to our sister agencies, higher level lowers of care. We work with them to coordinate that and make sure that we're meeting all of our clients where they are and help to get them connected to the services they need.
Hi, good evening, everybody. My name is Stephanie Ramirez. Thank you for being here and allowing us to talk to you about our organization, REACH. You can go to the next slide. So who are we? REACH is a program who serves people who are having a behavioral health crisis, but they also have to have a developmental or intellectual disability. So this is a very unique service that isn't provided by many states, but we're happy that we're able to do so. We not only provide immediate crisis response, but also education to families, communities, group homes, schools. We want to make sure everybody in that person's system is well educated on how to support that particular person. We also do community stabilization sessions, and that's what, like, scheduled sessions in the home or in the school, in the group home, with the individual and their systems. So that's post-crisis, so that we can make sure that we're preventing future crises. We also have my very favorite service, which is our residential crisis stabilization units. And we have one in Woodbridge for adults, and we have one in Culpeper for youth. And you guys are the first to hear today that we will have one next summer for youth in Fairfax. Is that right? I know, very exciting. We are able to serve the entire state with those homes, not just the 5 counties that we serve here in Northern Virginia, but our other services are just for the Northern Virginia counties and city of Alexandria. All right, so to be eligible, you do need a diagnosed developmental or intellectual disability, meaning that it needs to be by a mental health professional stating in writing that you have this diagnosis. But if you have an individual in your communities that is, let's say, suspected to have an intellectual or developmental disability, that also can be documented, and we can give them a portion of our services, but not full services until they get that formal diagnosis. For language capacity, same as CR2, we're able to provide interpretation services in the person's preferred language. However, we also have a couple of great staff who speak 2 languages and are proficient enough to provide services ethically. The cost, again, just like CR2, our sister organization, no costs. We will bill Medicaid if we can, but otherwise the person will not receive a bill from us. And we actually just got a really nice email from a family who thought they were going to receive this ginormous bill after their child was with us. And they were so grateful. They were like, how can we donate the money that we didn't spend? That was really nice to hear. Okay, next slide. So our services can be accessed 24/7 using our hotline number. That hotline number is also not just for crisis, but for the referral line. So sometimes we'll get case managers from the CSB calling us to say, hey, I have a client, and they'll sit with us for 10 minutes on the phone to do that referral, and then we'll be contacting that client pretty immediately. The 24-hour crisis hotline, too, that is where that person can get de-escalated either by the phone, or we can go in person and do a dispatch, no matter where the crisis is. Sometimes it happens on a basketball court or a Target Walmart parking lot. Sometimes it's in their home. We do work alongside 988. So if a client calls 988, they can easily be transferred to our hotline instead so that we can provide that service pretty immediately. And we try to make sure that we can do warm handoffs with our sister organization, CR2, as well, in case they got the wrong number or didn't know that they were eligible for our services. Okay. We also, just one more thing about that slide, we do provide trauma-informed services, as I hope most organizations these days do. But that definitely keeps in mind the safety of our individuals, not just physically, but also psychologically. And so we're always doing a lot of training with our staff in order for them to be up to speed with what that means. Okay, next slide. Thank you very much.
Good evening. My name is Gabriel Duer, and I think I have only 7 minutes, so I will speak fast, something I do anyway, but at least now I have a justification for that. One thing I want to say, you heard from my colleagues about community programs, and you will hear from me in a second about county programs. Something I want to emphasize is that we share the same goal, which is to serve people in crisis. And we share our clients. Most of the time, individuals may receive services from many of our programs, and we talk to each other all the time. We discuss our workflows. And if the system works well, and this is not always the case, you should be able to access the crisis continuum at any point and be referred to the right program in a way that the program will match your needs and the type of crisis you are experiencing. Having said that, each program has the special configuration and a special expertise and a particular set of skills. And I would like also to tell you about the programs that we operate in the county and what is that each program does. I'm going to speak about 3 programs, starting with emergency services. Emergency services is a team of behavioral health clinicians that are specialized in the assessment of behavioral health emergencies and provide accordingly crisis intervention. This is a team of very skilled clinicians that go through a quite extensive and lengthy training, and they're certified by the state. By the way, this is something specific for emergency services. It's a code-mandated program. The Code of Virginia mandates that any jurisdiction, any CSB in the Commonwealth needs to operate an emergency services program. And they function 24/7, 365. They do a bunch of things. They do a lot of things. They do evaluations. They receive referrals from anybody in the community, the school system, the jails, the hospitals, the community at large, everybody. They provide an evaluation to determine what is the nature of your crisis and what is the right approach, what is the right response, what is the appropriate level of care for your crisis. They provide immediate support to relieve and resolve the crisis, and always with the less restrictive option always in mind. They may recommend outpatient services. They may recommend a voluntary admission to the hospital, and they also intervene in specific circumstances. This team is certified to get involved in scenarios when someone is in crisis, presents with significant risk for themselves, for others, for the community. They need to be in a hospital. They cannot consent for treatment, and these people are certified to conduct an evaluation to determine if people needs to be involuntarily admitted to the hospital. But definitely this is only a small part of what they do on a daily basis. In addition, when someone is admitted involuntarily for those reasons, there's a legal proceeding that takes place. It's what we call a civil commitment hearing, and this team is responsible for coordinating the process. And sometimes during those hearings, the judge will order for someone to do therapy or to see a doctor for X amount of time. This team is responsible for monitoring the safety of these individuals and guaranteeing that they're complying with the treatment that the court has recommended. So they do a lot. They also have a staff with lived experience, a peer specialist that provides support during the crisis and also do follow-ups post-crisis. Who do they serve? They serve everybody in Arlington experiencing a crisis, and that is another specific trait of this team. Most of the CSB services are for Arlingtonians. Emergency services serves anybody. Currently at Arlington during the time of the crisis. And as we know, Arlington is a place with a lot of transient people stays in. We have the airport, and they deal with anybody experiencing a crisis. So that is another specific trait of this team. And any age, everybody along their lifespan. Next slide, please. So as I mentioned, they serve anybody. And in regards to language, we have on a limited basis bilingual staff, and they have immediate access to video and audio interpreters when needed. In regards to the cost of the services, the program is a network for Medicaid, Medicare, and a small number of commercial insurance. However, there's a sliding fee in a way that functions in a way that nobody lives without services. We can reassure that everybody will receive emergency services as needed, even if you're uninsured or have no income at all. Next slides, please. How to access emergency services. Again, I mentioned 24/7. This is the number you need to call, 703-228-5160. You will be connected immediately with a clinician that will discuss with you the nature, the magnitude of your crisis, and will discuss with you what are the next steps. And you may call on behalf of a family member or someone that needs services. You can call them and consult anytime. They will discuss, and they may offer for you to come to our office to conduct a face-to-face evaluation. They may coordinate a telehealth evaluation if you have access to a computer and that works better for you. Or they can assess people in the community, sometimes, frequently with police. Based on, as I mentioned earlier, based on their assessment, they will determine what is the level of care, and they might refer you to other type of services, or they will assist you with going home with a crisis management plan, a number of coping skills that will help you managing the crisis when you go back home. So there's an array of potential outcomes when you meet with an emergency services clinician. They may include a referral to our partners, as I mentioned before, a referral for CR2 for further stabilization, right? So again, assessment and crisis intervention are the key words here. Next. Let me mention another program we operate in the county. This is the Crisis Intervention Center, or CIC. When we think about a crisis continuum of services, we think about someone you can call if you're in crisis, someone that will respond if you're in crisis, and a place to go. Those are the three main components of a good crisis continuum. This is our place to go. This is a clinic, a walk-in clinic that we operate in the county that also operates 24/7. And this is a place where you can go if you need to see someone because you're in crisis. The services we offer, obviously, behavioral health evaluations and crisis interventions, psychiatric evaluation and medication management during business hours for now. We are in the process of expanding that service to 24/7. We're not there yet. But for now, during business hours, you can see a psychiatric provider that can conduct an evaluation and immediately provide medication if a pharmacological intervention is what is required. We have nursing services. You will meet with a nurse for a basic medical screening to determine that you're medically stable to be assessed at our crisis intervention center. And we also have people with lived experience that will, again, assist you during the crisis and to navigate the crisis and post-crisis too. As we know, crisis is just one moment in a process that requires further treatment and aftercare treatment, right? So in addition to addressing the crisis, we want to be sure that you get the services after the crisis, that you need to remain stable. The peer specialist support are a key part of that process. In addition to walk-ins for the public in general, this clinic accepts drop-offs from Arlington County Police Department and the fire and EMS. As we know, law enforcement and fire and EMS encounter all the time people experiencing behavioral health crisis. And historically, the emergency room at the hospital has been the place to go for them. We are trying to divert them from the ER to create an alternative space. The emergency room may be the right place, but not always. We can create an alternative space for the police department and fire and EMS to drop. I'm being reminded that 2 minutes is what I have. We serve everybody, like emergency serves anybody in the county experiencing a crisis. Next slide, please. Now I'm self-conscious, all right? Anybody experiencing a crisis, the same thing applies to all of the programs in the county. We have, on a limited basis, bilingual staff, but access to interpreters immediately, in video and audio. The same thing about cost. We can move to the next. You can just...
Ask you to hold the mic.
Oh, sorry.
Yeah, it's not picking up well.
Can you hear me without the mic?
No, we need to pick up
Oh,
the live stream.
okay. I will stay then. 24/7 at 2020 Washington Boulevard. You will meet with a clinician, you will meet with a nurse, they will conduct an evaluation, they will determine what is best for you, and they will make a number of recommendations that can be, again, outpatient services within the county or outside of the county. They might refer to a private provider, if that's what is indicated, or many other programs, including inpatient care when that is what is needed. Next. We talk about someone to call, someone to respond. This is MOST. MOST is a team of behavioral health clinicians. The team also include a peer specialist and a case manager. This team is dispatched by 911, the Emergency Communication Center. This is not a team that you may access by calling them. They are dispatched by 911. Sometimes they're secondarily dispatched by police officers in the field. When they respond to a call for services, identify a call as behavioral health related, they can request for MOST to respond. And the same thing applies to EMS and fire. As we know, before this team, police were responding to crisis. And the initial step we took is to train police on behavioral health issues, but the following step was to provide a behavioral health response to this crisis. And this is what MOST does. They respond, as I mentioned, they are dispatched from 911. They operate now between 10 a.m. and 6 p.m. We already have funding and staff to expand. The program has been quite successful, and I anticipate in the next few months to have 12 hours of operation during weekdays, and hopefully at some point during weekends too. They will do evaluations, crisis intervention. They provide the peer support that, as you probably heard, has been a common theme in all the programs we operate. And also we have a case manager. As we know, many of the behavioral crises are associated with issues around basic needs, housing, employment, food. So they can do an assessment in regards to the case management needs and connect individuals with the services. The same pattern with all the other programs we operate. We serve everybody. You just need to be in Arlington and have a crisis, and we'll be there. Next. They have 2 beautiful bands with a lot of resources inside, and this is how they operate and respond in the county. The same issues about language capacity, and there's no cost for most services. And I think I finished on time. Thank you.
Thank you all. Thank you. Thank you so much to all present and virtually for joining us today to learn about the county's crisis continuum of care. We hope you found today informative and beneficial. Thank you.